Fox 4's John Pepitone reported earlier a debate is heating up among scientists and public health officials around the world. Should we delay second doses of a COVID vaccine so that more people can get that first dose? The executive dean of Kansas City University, Dr. Darrin D'Agostino, joins us this morning. Dr. D'Agostino, have you heard about this debate and what are your thoughts?
Good morning, Abby, and I'd like to say hi to Mike also. I think, yes, I have heard about these debates, and this is actually something that has to be considered both at the very beginning of the vaccine schedule that has been put together, but also as an audible that can be called if we are not gaining control over the viral spread. So let me explain. There is a strategy to only giving one vaccine and not mounting the full potential of a two-dose regimen, but giving enough so that we can catch up with our mitigation strategies and decrease the spread. And this is something that the Brits have done. And in England, they are actually doing a one-dose regimen to get more out to people. Now, there are some downsides to this because catching up or trying to get a second dose becomes logistically much more difficult. You're also extending the length of time that people will continue to spread the disease. But it all depends on how much control we can get through individual efforts at mitigation. So wearing masks and staying 6 feet away from people and continuing those strategies.
So this is something that could very well happen. And with that first dose, again, could you remind me sort of what the efficacy is if you just get that one shot?
Yeah, for the mRNA vaccines, it's about 50%. And for the new AstraZeneca one, it can be as high as 60% after that first dose. Now, those vary. It depends on the age of the individual and comorbidities, but there is something. And remember, just to remind everybody, in a good year, the flu vaccine is only about 65% effective, and in general, between 35 and 45% effective. So we're used to having vaccines that don't completely protect people, but do mitigate the spread of a virus.
Okay, and so that could be some encouraging news there at least. Some people are comparing thalidomide and the COVID vaccine and using this as a reason not to get vaccinated. So first of all, what is thalidomide? I'm not sure if I'm pronouncing that correctly. And what is your response to this?
You are pronouncing it correctly. And this one is very difficult to talk about because it is only misinformation, disinformation, and out there to worry people. Thalidomide was a medication that was used in the late 50s and 60s. It was produced to help with nausea and vomiting in pregnant women. And what was quickly found out was that it caused birth defects that are very significant. Now, what's important here is that these birth defects and this medication really highlighted the fact that we have to have stringent testing before medication can come out, and in fact helped inform the process that we use today to make it safe for people. And it's a shame that the thalidomide fiasco actually is causing people to not get a vaccine that has been tested and is proven to be safe in the vast majority of people that are getting it. Those people that had thalidomide issues are in their 50s and 60s now, and quite frankly, it's insulting to use thalidomide as an offense against getting vaccinated for COVID. So it should not be compared. The vaccines for COVID are proven to be safe, and we should be giving them now.
All right, Dr. D'Agostino, thank you so much for always coming on our show and answering all of our questions. We appreciate it, and we'll talk to you again later on this week.
Take care, Abby. Thank you.
Thank you.